Your patient's name isn't protected health information, neither is their birthday, and neither is their diagnosis. But put any two of those together, and suddenly you're looking at HIPAA violation. That's the thing nobody explains clearly. Protected health information isn't a list of forbidden words, it's about combination and context. If you work in healthcare as a biller, a coder, a provider, an admin, you will touch protected health information every single day, and the consequences of mishandling it aren't theoretical. Fines run from $100 to 50,000 per violation. That is per single violation. By the end of the video, you'll know exactly what qualifies as protected health information, what does not, and how the line between them is a lot blurrier than most training courses admit. Here is the official HIPAA definition of protected health information, stripped of the legal part. Number 1, health information that identifies or could identify an individual, created, received, or transmitted by a covered entity. 3 parts, all 3 have to be true. Miss 1, and it is not protected health information, at least not under HIPAA. Health information is just broad. It's not just diagnosis, it's treatment records, payment records, insurance information, mental health notes, basically anything related to a person's past, present, or future psychological or mental health condition. Could identify is where it gets interesting and where most people get tripped up. It doesn't say does identify, it says could. That one word does a lot of work. A hospital room number alone, probably not a protected health information. A hospital room number plus a date of admission, getting closer, and if you add a diagnosis, now you have protected health information. Because someone with enough context could figure out exactly who that patient is. HIPAA defines 18 specific identifiers. If your data contains even one of those, and it is connected to health information, it's protected health information. Names, geographic data, including zip codes, dates, and here's the kicker. Any date more specific than a year that relates to an individual, birthdays, admission dates, discharge dates, death dates, all of them. Phone numbers, fax numbers, email addresses, social security numbers, medical records numbers, health plan beneficiary numbers, account numbers, certificate and license numbers, vehicle identifiers, and serial numbers. Also device identifiers, even web URLs and IP addresses. Biometric identifiers, that means fingerprints, retinal scans, voice prints, also full face photographs, any other unique identifying number of code. Yeah, also IP addresses. If your patient portal logs an IP address alongside a user's health record activity, that's protected health information. Think about that the next time someone asks whether their web analytics are just metadata. Here's where the most organizations make mistakes. Not on the obvious stuff, but on the edge cases. HIPAA has two paths to de-identification. Expert determination, where a statistician verifies the re-identification risk is very low. or the safe harbor method, where you remove all 18 identifiers and have no actual knowledge that the remaining data could be re-identified. The keyword is all 18. Leave one in, and your de-identified dataset is still protected health information. Misconception number 2. If the patient is dead, they still have protected health information. HIPAA protects health information of deceased individuals for 50 years after death. If you're handling records from 1974 or later, that protection does still live. Misconception number 3. Verbal conversations aren't protected health information. Protected health information isn't just written or digital. Information discussed about the patients in a care setting is protected. The medium doesn't matter: paper, screen, or a spoken word. And these are some of the real examples. The spreadsheet. A hospital exports a spreadsheet for a research project. They remove names, SSNs, dates, but they live in zip codes and ages. And one row, 87001, age 94, Alzheimer's diagnosis. There may be only a handful of 94-year-olds in that zip code. With a diagnosis like that, re-identification is realistic. The data is still protected health information, and sharing it without a data use agreement is a violation. Case number 2, the email. Three identifiers right there: name, date, and a procedure. Sent over standard unencrypted email, protected health information bridge, depending on the covered entities policies and the email system used. Case number 3, the photo. A nurse posts a photo of a patient's room just showing the view. No patient in frame, but the window shows a distinctive skyline. And the photo metadata includes the hospital geolocation. If someone posted this alongside any reference to a patient's condition, even in a private Facebook group, that's a HIPAA risk. And that special category that I mentioned earlier: mental health records or substance use disorder records, HIV status, and genetic information all carry additional federal protections beyond standard HIPAA and stricter consent requirements. Tighter access controls. If you handle any of these, standard protected health information rules are the floor, not the ceiling. And what does this mean for you? Every time you're handling patient data, there's only one question that cuts through the confusion. Could someone identify this to a specific patient? If yes, treat it as protected health information. If you're not sure, treat it as protected health information once again. The burden of proof runs in one direction under HIPAA, and it's not in your favor when things go wrong. Your organization should have a minimum necessary policy, meaning you only access, share, or use protected health information that's actually needed for the task. Not the whole record, not the full history, just what's needed. And protected health information isn't a list of forbidden words. PHI isn't a checklist that you run on through once. It's a way of thinking about data. Who could identify this person? What could they infer? And what is the risk if this lands in the wrong hands? Run that question every time. Build that instinct, because the line between a compliant and non-compliant often aren't obvious. It's hidden inside a zip code, a date, a photo of a window,